Good evening, everybody. Welcome to our live. This is Limit Hospital, where today we're going to be discussing about the commonly asked questions on infertility. With me is our consultant ONG, Dr. Taiwo,
I'm Taiwo William.
and my name is Dr. Winne Uche-Ikonne. Welcome. So, Chief, you want to take the lead?
Yes, and as earlier said, today we'll be discussing some common questions about infertility. And this is very, very important as consultation is one of the most common things that we see in clinic. Quite a number of people are having challenges having their home babies, and that is why we want to still enlighten you, our uh, brothers and sisters, mommy and daddy at home, about what causes fertility. How do we take care of fertility issue? So, and what are the burning questions about fertility issues? Because it's good to know that one is having delay, but it's also very, very important to know what to do, because our responses determines the outcome too, if whether we are going to the right place for treatment or not. So it's actually very important. And we want to please appeal to all our viewers out there. If you have questions that you want to clarify, we want you to please send it across to us so that we can discuss those burning issues and clarify those issues for us, and we can move on and achieve a good outcome.
So let's start with definition of infertility. So basically, what is infertility? Infertility is the inability to conceive after 12 months of penetrative ejaculatory sexual intercourse for 12 months, okay, without any form of birth control. Now, it's also important to note that this definition of infertility, even though that's is worldwide, but for women below above the ages of 35, would advise that you don't wait for the 12 months. You can come to the hospital.
In fact, what is advised is that once we have an advanced maternal age, we
Yes,
want to start investigating for the possible cause of
the infertility.
infertility. Meaning that 6 months after trying, penetrative ejaculatory sexual intercourse, unprotected penetrative ejaculatory sexual intercourse, because it's very important. Those are the key things. We must not be using contraceptive. It has to be penovaginal, penetration. It has to be the husband, the man has to ejaculate. It's important. When we have done this, you know,
And at least three
for a
times a
couple
week.
of yes, average
Yes.
of 3 times a week for about 6 months to 12 months, and we are not able to achieve pregnancy, then we need to see our gynae.
Yes. And let's talk about the types of infertility. So there are two main types of infertility. There is a primary infertility, which basically means that a woman has never been able to conceive. She has never been able to be pregnant. And the secondary is when a woman has been pregnant before, doesn't no matter how it ended, no matter what the
If
outcome
that's
was,
irrespective of the
irrespective
outcome
of
of
the
pregnancy,
outcome, yes.
whether it resulted into miscarriage
Yes.
or the woman voluntarily remove it,
Abort, yes.
or there is a live birth, you give birth to baby at term or preterm or intrauterine fertility, irrespective of the outcome of pregnancy. This woman had been pregnant before, but now she's trying to get pregnant and has been unable to do so. So that's what we call secondary
Secondary
infertility.
infertility. Yes. And
Whether no, not only woman, no, it affects
male and female
if
too,
a man has
yes.
impregnated someone before, you understand, he knows he has impregnated the person. So of course, it's a different ballgame from he has never been able to achieve pregnancy, but we define it
Yes.
using the woman as the
As a
baseline. Then,
baseline. Thank you. And then we want to talk about the factors affecting infertility for both the male and the female. So the number one, we want to dive into the frequency of intercourse. Like we already talked about, you should be having penetrative penetrative ejaculatory sexual intercourse 3 times a week.
Average.
Average, yes.
Average.
Average of 3 times a week. You can always go more than that.
Eh.
And
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 why is it important? It's important because the lifespan of spermatozoa, which is the sperm cells inside what the man will have released in the vagina, stays for average of 2 to 3 days. It can be up to 5 days.
yes.
But on the average, we have it up to 48, 72 hours average. So if we do uh, every 2 days, not more than 3 days, there is that likelihood that we still have an active spermatozoa in a woman's, reproductive tract that will be able to fertilize egg once ovulation takes place.
Yes.
So that's why that frequency of intercourse becomes important. And that's one of the challenges we are having now, because most of the couples now are working class. The husband is working in another city or another state. Madam is working away from Oga, and the frequency of sexual intercourse is now very.
And coming home and you're tired.
Or some of us now weekend husband will be, or monthly husband or monthly wife will be. These are some of the issues. Okay.
And the timing of the intercourse is very important, because you want to be sure that you're also having sex during your ovulation.
Very, very important.
Yes.
Every woman, God has programmed every woman in a way that there is a particular time that the woman has to ovulate.
Yes.
If the woman or the couple want to get pregnant, there must be sexual intercourse, unprotected, penetrative, ejaculatory sexual intercourse around that time of ovulation. So that's very important.
And also, some things that can also affect the infertility will be the STIs and other infections.
That's what we call sexually transmitted
infections.
Yes. Our people out there, they are aware of gonorrhea now. It's on the streets. When you go out now, you will hear some of our other people too talking about this particular drug is effective in treating gonorrhea, chlamydia, all those. Yes, we have sexually transmitted infection, especially the likes of chlamydia trachomatis, Neisseria gonorrhea. We have some other ones too that are equally very important and can cause, fertility issue, because they can affect the uterus, the uterine cavity, causing endometritis. They can make the uterus to glue together. They can affect the fallopian tube and making it to be blocked.
Yes.
You understand? So that's why in our own environment, in the tropical region here, it is said, it has been found through research evidence that tubal factor infertility, which is tubal fallopian tube blockage, is one of the most common cause of infertility in this our environment. Therefore, every effort to reduce sexually transmitted infection in this place will help us in reducing infertility.
And also finding out, going to a good hospital and getting tested and getting the right treatment.
In fact, very, very important. The common thing that happens in our society, sometimes we see some of these things and we try to discourage our patient from doing that. Patient will come to the clinic, oh, I'm having abnormal vaginal discharge, and we have investigated, okay, we are giving them drug for them to make use of. Many people, once they get relieved a bit, rather than completing the course of antibiotics, which may be for the number of days, like within 10 to 14 days, usually, you understand, they neglect it. Meanwhile, they have not completely treated the infection, cured the infection. So it can cause damage. Some people don't even come to the hospital, they go to maybe laboratory to do tests, and from there they enter some chemist shop that will just place them on some medications, and they may not even adhere to it. These are the things that leads to damage of the reproductive tract, the uterus, the fallopian tube, which is important. Of course, age is important, especially in females. Is very important. The older we become, the lesser the number of eggs that a woman will have, and the poorer the quality of the eggs too. So it's very important. And meanwhile, in our present world now, we are all working class. Everybody, because of school, we are delaying childbirth, unlike our own grandmother that at age
20, 19,
18,
yeah,
19, 20, they are already
mothers.
married. By the time they are getting to 28, they are finished their reproductive career, or 30. But in our present age now, people are delaying their reproductive career till when they are 30, 35. Even some is 40. You
Yes.
understand? Which is something that is actually affecting fertility potential. Even when you look at nutritional status, because it affects us is in both way. People that are excessively on the obese side, you understand, obese patients, they can have some challenges that can affect ovulation. They can develop medical conditions that can affect their potential for getting pregnant, you understand. Those that have low weight too, that are malnourished, you understand, underweight, they may equally have, of course, their immunity might not be as good as, of course, as those people that have normal weight, you understand. So that can equally predispose them to infection that can affect some structures like reproductive tract.
Yeah.
So it's actually important. We need to balance this when it comes to nutrition. So very, very important. And the lifestyle that we live, because we all know, we are all aware that, of course, smoking can affect potential for fertility. It can affect a woman's ability to produce egg. It can affect a man's ability to produce sperm. So also alcohol intake. So very important, and other substances that people abuse today, and that's why we are equally advising that please let's try to stop, or we do in moderation in such a way that it doesn't
Cause any
affect
damage.
our fertility potential.
And let's talk about the causes of infertility. We want to take the hormonal causes first. So when we talk about hormonal causes, we're talking about hormonal imbalance. Because for you to conceive, your hormones need to be in check. They need to for your hormones need to be in check so your eggs can be produced and you'll be able to even sustain a pregnancy. So there's some conditions that can cause hormonal imbalance. We have the PCOS, we have issues with
In
the
fact, before we
sorry, polycystic
discuss
ovarian syndrome.
the detail of that, it's important to let our listeners and viewers out there understand that when it comes to fertility, especially uh, in both women and men, there is an interplay of hormones, starting structures, starting from our brain to our reproductive organs. They need to send signal to each other, and there must be balance in that signal. That's why my colleagues here mentioned the fact that hormonal imbalance can be a reason why there is delay in fertility. The hypothalamus is structure in the brain, so also the pituitary gland, and the ovary. They must receive hormones, chemical substance, signal.
Also,
When they do that, also, of course, there is what even happen, especially at the level of the uterus too, in the endometrium. There are things that has to happen too. So if there is imbalance, it's going to affect chances of conception in a woman. Very, very important.
I, Chief, would you say because when a woman, when there's infertility in a family, of course the woman is blamed more. So we talked about how stress also affects, can play a role too in infertility because it can affect the hypothalamus as well. So what advice can we give to women who are actually going through infertility and are anxious and don't cause anxiety. If you're anxious about having a baby and all of that, then you're not really going to get your achieved results because also it also plays a part in hormonal imbalance.
Yes, infertility has, impact on our psychology, emotions. It has impact on our physical health. Very, very important. The psychological impact of infertility is significant, and that's one aspect that we don't neglect. We want to take care of it because we know waiting. We are talking about having sex, and some people have asked, is it food? You understand? How come we are prescribing, man and woman to be seeing themselves in the house, to be having regular, protected, penetrative, ejaculatory sexual intercourse? You understand? yes, it can be devastating. And one thing I want to emphasize here to all our listeners out there is that the causes of infertility is not only in woman, no, is in, it can be because of problem in a woman, it can be because of problem in her husband alone. Also, the two of them might have issues, they may have problems affecting their fertility potential. And there is another fourth, the fourth category of people that, having investigated, we have, taken history, examine the couple, we have done investigations available in the environment, we might not be able to pinpoint any problem in the man and his wife. We might not. That's what we call unexplained infertility. Yes. But before we say unexplained, we must have, rule out possible causes, from them. And then there are ways we treat each one of them. It's dependent on what exactly is responsible for this.
And then tailor it to your need. So the other causes too, like
Of
like the
course,
ovarian.
if you want to take the woman, when we look at the causes, it can be something that is affecting the brain. You understand? We talked about hypothalamus, we talked about pituitary gland. Stress many a times can suppress the function of those structures. They might not be able to send appropriate signals to the ovary to produce egg. And that is why we encourage the couples with, this kind of with subfertility or challenges in getting pregnant. We want to encourage them, we want to reassure them to calm down, to relieve, to stop being anxious or being depressed. We want to, motivate them, for them to see, the fact that yes, it's delay, not denial. We can get over it, and we keep on motivating them. That's that. Why we are working on
Potential cause.
potential cause and the treatment.
Yes.
So it's very important. The stress could be maybe, of course, stress of delay, stress from people around, especially in this part of the world. Is the woman that is the
That's a
witches,
problem. Yes.
in the house. That's the one that is swallowing all her egg and all those things. And we have family member putting pressure on the woman. And I want to seize this opportunity to encourage all the husband out there of our women that are having this delay to please be supportive. Many a times they go through undue stress that will never help the situation. Instead, they will make the situation worse. We want them to show love. We want them to work together in unity, because it takes two to tango. Without the semen available, us having regular sexual intercourse, we cannot achieve pregnancy.
Yes.
Yes, it's very important. So please, we need that support. And I am also seizing this opportunity to let us know that infertility treatment is not a woman's affair alone. The husband, the two, both man, the husband and the wife must should come together, so that they can listen to the same, counseling, what they need to do. They can be investigated together, and we teach them what to do, and they can work through it together. And by God's grace, God has been helping us. In 9 months, in 1 year, they already have their babies. That's it. So it's very, very important. There are things that can affect the ovary. Ovulatory factors, we call it ovulatory factor. It may not make the woman to ovulate, like polycystic ovarian syndrome. We have multiple small eggs, but they are not growing to the point of getting released. So is a common cause in our environment. Although we also have the tuber factor. Of course, even apart from that, some people have high prolactin level, maybe because of the enlargement of the pituitary gland in the brain that is producing that one. It may suppress, it may not allow ovulation to take place. So it's very important. There are some drugs that some people take, you understand, that can make it can make some things, some hormones to be high, and they can suppress ovulation. So it's very important. That's why we take history. When they come in, we want to know what could be responsible and know how to work around this. So it's very, very important. We have the tuber factor. Of course, the notable cause of fallopian tube blockage is sexually transmitted infection, which we have earlier mentioned. You understand? That's why we are talking about, reducing the sexual partner. Multiple sexual partner is a risk factor for contracting sexually transmitted infection.
Infections.
There is even what we call, of course, for some people, they have a single partner per time. But in the long run, it may result into what we call multiple sexual partner in a way. The woman is faithful, but the man might have some other
Yes.
ones that he sleeps with. The same thing, the woman too. Some women too have more than one
One
man
man,
that
yeah.
they sleep with. The risk of catching infection is there because you don't know whether the person is faithful to you alone or not. So it's very, very important. And when we are doing this, of course, one of the things that we encourage is to use protection, especially condom. We have both male and female condom that can help in reducing the risk of sexually
Infections.
transmitted infection. But we also, much more importantly, we encourage faithfulness in marriage. You understand? Faithfulness with our partner, because that will reduce the risk of catching all these sexually
Yes.
transmitted infections that we can catch from somewhere and transmit it to another person. So we want us to please look into this and reduce that chances. So it's very important. Of course, there may be problem with the uterus, like some people may have uterine fibroid. Uterine fibroid is usually is not a direct cause of infertility, but quite a number of women who have uterine fibroid might all equally have
Difficulty.
infertility. Yes, we have a number of them that don't have issue getting pregnant, but of course, if we come around and we have this in any of the patients, the physicians or the gynecologists, we explain the details of how this can actually affect fertility potential. There are other things that can equally affect the endometrium. That's where the baby grows. Sometimes some people, because they have a miscarriage, incomplete miscarriage, and they do some evacuation, if not done properly by trained people, it can get complicated. They can over scrape, there can be infection, what we call endometritis. It can cause the gumming of the uterine cavity. That's what we call intrauterine adhesion. Of course, when there is something like that, fertility potential will be reduced. In fact, the woman may also not see her menses. It can cause that. Cervical stenosis is one of the, when the mouth of the womb, which is the cervix, narrows. Sometimes maybe because maybe a woman had when she delivered her last pregnancy, she might have cervical tear. When they are repairing, they have narrowed the cervix. It can cause that one too.
Because the
Is
sperm will not be able to
Yes, sperm will not be able to
go through.
go through. That's one thing about it. So that's that. We can have some other congenital abnormalities, like people that have some tissue blocking their upper part of the vagina that is not allowing sperm to ascend. That may equally not allow menses to come out too. So it is possible. Cervicitis, infection of the cervix, infection of the vagina, chronic, they can ascend into the through the cervix into the to the uterus and fallopian tube and cause damage. So it's very, very important. Let's talk a little bit too about even men too can have of course there are if
Because
infections is very
the
important. Infections like gonorrhea too can cause damage to the vas deferens or to the urethra where uh, sperm is expected to pass through. So infection in men too. There is what we call this mumps, when this swelling that used to make the cheeks to be
especially in
swollen around.
childhood.
Yes, around the times of before puberty, it can destroy the all the things that will help in producing sperm. So that one is there too. We can equally have people that have swelling of blood vessels around the testicles. It can affect what we call varicocele. It can reduce the fertility potential. We have people that when during childhood, God has made it in such a way that the testicles they come outside because they don't need as much heat as we have in our body internally. But in the course of coming, they can get stuck in the inguinal canal along our groin. And if that happen, they will be exposed to the internal heat, which can affect their functionality. So that one, and that's why when a child has undescended testes, you understand, we want to correct it
Immediately,
at
as soon as possible.
of course pediatric surgeon usually take care of that, and some other the pediatric surgeon usually takes care of that. So that's that. We also have sometimes some abnormality in the movement of semen. It can happen.
Yes.
Of course, there are other lifestyle that can affect fertility potential. Smoking, alcohol, they affect the production of semen. The same thing with
With
women
women.
too, in terms of their production of ovum or the eggs. So that's
So,
it.
I please send in your questions. We're taking your questions for the end of this presentation, please. We want to talk about the basic workup for infertility. So we've talked
Okay, you
about
meant
the
you meant
causes,
how we
how we can
investigate, how do we diagnose?
diagnose infertility.
uh,
So we've talked about the hormonal factors, right? So we have to do a hormonal profile for that. That's one of the ways we can also
If you are just
use
joining
this.
us, this is Instagram Live Living presented by the Living Hospital, and we are discussing common causes, or common questions people ask about infertility. We want you to keep your questions coming because that will help us to be able to communicate with you, our audience, well. We want to address your questions, and if we cannot totally completely address all your questions here, you can see any gynecologist in any facility of your choice, or if you choose to come to our facility, we are open to receive you.
Welcome. So back to the investigations we do for the can do for the infertility.
Of
So
course,
we've
that
talked
starts
about
from
the
history
yes
and
history taking and
examination.
examination.
It has to start from there.
Yes.
It's not like you are just going to one laboratory to just do it. I want to check my fertility potential. What
Yes.
exactly? We need to know what has happened
In
to
the
the
past.
individual. We want to examine to see, because those two things will guide us the direction, the kind of test that you want to do. There are basic tests, there are things that sometimes too you may have to consider based on what you find on examination, on history, from history and examination of the woman and her
Woman.
partner. Very
Yes.
important.
And then the hormonal workup for hormonal imbalance. And then we can also have we need to have the evidence of ovulation, like we talked about for women who have difficult ovulation, like PCOS and any other disorders with the ovaries. So we
So
need to know that you're able to ovulate, and that we do that by follicular
there are
tracking.
tests that can be done, but we don't need to
Like,
exhaust all those ones. It will be necessary for us to see a gynecologist so that we can have an idea of what is available to us that can be done, to have an idea whether a woman is ovulating or
or
not
not.
ovulating. Yes, very, very important. And when you talked about the hormonal profile, there are a lot of hormones that can be checked, but there are some that are specific that will help us
To
to know
diagnose.
whether a woman might be having some anovulatory or hormonal imbalance, whether the ovarian reserve of the woman is good or not. So it's very, very important. It's not just to walk to any site laboratory and run some tests. Of course, we also want to be sure that the fallopian tube is patent. There are different tests that can be done. I know most people know what we call HSG, because the first thing that comes to mind is painful procedure, which is not so. It depends on what conditions the woman have, tuber patency or not, and there are some other comorbidities that can make her to feel pain, but most people have HSG done to check for fallopian tube patency without pain. Please, if you are out there and they have asked you to do hysterosalpingography, HSG, and they have told you that it's painful, it's not entirely the truth. Meet a specialist. Let them, whether a radiologist or a gynae, let them discuss, let them counsel you about it. It
And
can be helpful
and it's a
in
bit
your
therapeutic
management.
as well.
Yes, it can even help a tube that is just minimally blocked to be open. And quite a number of patients have testified to you that after their procedure, their HSG procedure, was when they got pregnant. Yes, that's what we see in the clinic. So it's very important. There are other things that can be done, like a laparoscopy and dye test, that sometimes if HSG is showing that the fallopian tubes are blocked, we can do that to confirm. The two of them are complementary, they are independent of one another, but they can help each other's findings. Very, very important. Even what we also know hysterography is also a useful test to confirm fallopian tube patency. Don't forget, for men, we need to do seminal fluid analysis or semen test. That's the single most important test in a man who doesn't have erectile dysfunction, but we've been having regular unprotected penetrative sexual intercourse, and yet there is no pregnancy. We need to do semen test. That's the first thing. Depending on what we now have, we'll be able to manage as appropriate. It's very important.
Let's get questions coming. Let's go into our main topic, the commonly asked questions. So we'll just be going through some of the questions we've gotten in the clinic.
The way we talked about the treatment,
The treatment.
let's just give them an overview of the treatment. What about it? The treatment is actually based on what we found. Some couple may actually not have issues getting pregnant. It may be because of frequency of sexual intercourse that we discussed. We encourage them to have adequate sexual intercourse. And by the way, sexual intercourse should not be for babies alone. It should be for pleasure. And the pleasure of sex, if we are actually having a pleasurable sex, is something that you never get satisfied. Every day you are looking forward to another pleasurable sex, and that's what we encourage, so that we don't get tired of having sexual intercourse, which is one of the common challenges that we have with people that are having delay in getting pregnant. So let's, as husband and wife, as male and female partner looking forward to having baby, let's invest in pleasurable sexual intercourse. Very, very important. So that being said, then we also help couples, especially the women, to know when they are likely going to ovulate, especially those working class women or women, couples that are living apart, because that might be difficult for them because of the nature of their work. So we want to know when a woman is likely going to ovulate, so that they make it a duty to have sexual intercourse around that time. It can equally help. You can see we are not talking about just you want to take drugs and all those. It's not all about drugs, but we need to understand how our system work. Is very important. There are some that may need medications. Whether the man needs medication or the woman needs medication, we determine after we have taken history, examined, and we have investigated and now know what is happening. Is it drugs to boost ovulation of a woman? Oh, does this woman have infection that has to be treated? So it's very, very important. Or we have fallopian tube blockage, meaning that there is not going to be a connection between the egg that is being released during ovulation and the sperm that the man has released during sexual intercourse. If the two tubes are blocked, there can never be pregnancy if they are truly blocked, and that will determine the kind of treatment. Of course, those group of people, definitely IVF will help them. You understand? But before we determine the kind of treatment, we need to investigate and have an idea of what the male partner has, whether there is problem in the male partner or in the female partner, or both, or we don't have. That determines it. And that is why fertility treatment is essential for couples to see their gynecologist for proper evaluation.
Yes.
You understand? And management.
Absolutely. So let's go into the questions. So someone in the comments said, I have a friend that has been trying to conceive for more than 3 years. All her tests is coming as not fine, and yes, she
Coming
has
out fine.
coming out fine, and yes, she has not been able to conceive. Has your friend seen a gynecologist? Has she been to the hospital? Depends on what measures she's taking. Like our consultant gynecologist here said, you need to find out exactly what is wrong and what kind of treatments you will benefit from. So I would want to advise you to encourage your friend to see a qualified specialist.
Is very important.
to
Not the people I called neighborhood doctors.
Yes.
Because experiences, people use their experiences, but this is what we see in our everyday practice, and we advise as appropriate. So it is very, very important for this person to see a
Gynecologist.
gynecologist for
Yes,
proper
please.
evaluation. I need to also emphasize that sometimes when we manage fertility cases, there are times that some couples might not be able to get, to achieve pregnancy immediately. We have some that will achieve pregnancy immediately, but we need that consistency. It is
Yes.
very important. And I want to discourage those, you have gone to this hospital 1 or 2 months, they have tried, you did not get any result, you jump to another hospital. When we do that, many a times there will be duplication of investigation that have been done that will increase the cost of treatment on the patient, that can also increase the stress and
Yes,
anxiety.
absolutely.
It's always important to choose where you want to receive your care, and you stay with them. Ask your question when you are in doubt of what is happening. Is always very important. But for this particular person, please, I will advise you see your specialist, a gynecologist, to
Yes,
advise
please.
as appropriate. They will counsel you on the modality of treatment that you will definitely benefit from.
Benefit from. And someone also said, how long should we keep trying to conceive before seeking help?
And
And
we've said it before
yes, we talked
that
about
after 12
12
months
months of
of
penetrative ejaculatory sexual intercourse,
unprotected
without any
sexual
form of
intercourse,
birth control.
yes,
And
very, very important. But
but
if the age is
yeah,
like 35
advance
and above, definitely you need to seek help. If you have
earlier,
tried
sooner,
for up to like
6
6 months,
months,
please.
seek help. And someone in the comments also said, how does stress and mental health impact infertility? And we talked about this earlier. If you're new here, welcome. We talked about this earlier about how when you're stressed out, it can affect the hypothalamus, which also
It
suppresses
can affect the brain
the
because
brain. Oh,
people
sorry,
don't know
the
what we call
brain. It
part of
can
the
affect
brain.
part of the brain, which will also
Yes.
suppress some of the hormones that are needed to actually achieve ovulation and help with conceiving and carrying a baby to full term.
That's why some people, when they are under chronic stress, whether mental or physical, they might not see their menses. And
Yes.
if you are not seeing your menses, it might mean sometimes, not all the time, that the person is not ovulating, because there are other things that might be responsible for inability to see menses. But that's how one of the things that stress can do. And the whole essence of encouraging our potential mothers and fathers out there to take it easy. Let's calm down, let's relax, let's go to the right uh, hospital where you can see a gynecologist that can evaluate you as appropriate, give you necessary counseling, and treatment is very, very important.
Someone said, can birth control pills make one infertile? Infertile, no. Birth control, but it can delay your period.
Actually, when you talk about birth control pill, of course, we have the progesterone only pill, which is not so commonly
Yes.
used now. But we have the combined oral contraceptive pill that is commonly used. It works by suppressing ovulation. However, when you stop using it, we expect your ovulation to
To
return.
return, yeah.
That is why people who have chosen to make use of combined oral contraceptive pill, we counsel them, we encourage them to ensure that they are taking their drug regularly. They are not skipping, they are not delaying. You understand?
Yes.
But
It's
more
that delay.
importantly, they are not skipping their drug, because when you skip like 2 or 3, there is that potential that you can ovulate.
Yes.
You have corrected that now, but ovulation can take place and you can get pregnant. One of the reasons why people says that birth control pill is not effective. No, now we fail am. We are the one that failed it, not that the pill failed us. We didn't take it as expected. So
Yes.
birth control pill doesn't really cause infertility. Yes, if you say some other modality of birth control, take for example like injectable, its been noted that for people who are on injectable contraceptive for a long period of time, sometimes their potential for return to fertility gets delayed. It can be up to 3 to 6 months, some can be up to 12 months after stopping the injection before they are able to return to fertility. It's not in all cases, so it's just in a
Some
few group
people.
of people. But this we need to discuss with our gynecologist.
Someone said, can infertility be prevented? Absolutely. Prevention.
It's not
Not all,
all
not all
cases that
cases.
can be
Yes,
prevented. You can imagine people that have congenital anomaly,
yes,
how would they be able to prevent it? No. But there are things that we have control over.
STIs.
In fact, if you are talking about prevention of infertility, it starts from right from the womb. When the woman is pregnant, there were conditions in many decades, maybe about 5 decades, 4 5 decades. They used to use one medication then, that if a pregnant woman takes it and then the baby in her womb is baby girl, it can affect the reproductive tract of the womb of the baby. That it is testosterone. It's not so common now. You understand? But one thing is that the fertility potential start from even the womb, especially in baby girls. So we want all newborn babies to be well taken care of, children to be well taken care of. If a child doesn't grow well, malnutrition, it can affect their fertility potential in the near future. A child that is not well taken care of is likely going to be exposed to indiscriminate sexual intercourse. Multiple sexual partner is likely going to set in. You understand? So if we take care of our young children too, you understand, we are invariably investing into their reproductive life in the near future. So it's very important. You understand? Of course, if you talk about women empowerment, one of the reasons why there are people that trade sex for money. If you have a good job, you will not do it. It's very important. We think it's not important in environment. It's important. It's key thing. That's why it has to do with our government and even ourselves too. Get child education. A child that is well educated will not just lis ten to somebody because of token amount of money that they want to give and now expose her to risk of sexually transmitted infection that can destroy her reproductive career. you know or you are having discriminate sex, you got pregnant, now somebody is now coming to you to tell you that go and remove that pregnancy, and there is no way. Voluntary termination of pregnancy is illegal. Is illegal in our country.
Yes.
You
Some people just
understand?
go to
Some people
quacks.
just go to quacks, and quite a number of life have been lost
That's very
through
sad.
you know uh what was it called, unsafe abortion, which is, or some of them come down with reproductive health issues, inability to menstruate, inability to get pregnant. If we prevent all this, it can help us. You understand? Even those that have incomplete miscarriage, where do they receive care to complete it?
The hospital.
You understand? Which hospital? Where? Who takes care of what? Because if not properly managed, you can have post-abortal sepsis that can affect their fertility potential. You can see how we deliver infection following delivery, because some people have what we call puerperal sepsis. It can affect them. So if we prevent all these things, we are preventing infertility.
Yes.
Then multiple sexual partner, we reduce it, we limit it. We have one and we are faithful to ourselves. We will reduce the risk of sexually transmitted infection. It's very, very important. You understand? So these are the important things that we need. If you now know you have multiple sexual partner, we encourage you to please use condom. We have both male and female condom. Yes, female condom may not be readily available, but male condom is available virtually in all chemists around the country. You understand? So let's make use of it. Very important. People that are smoking and drinking should reduce or limit or stop it.
And weight
You
gain
understand?
too, obesity.
Those that are on the B side, weight gain, those that are obese, it doesn't just start suddenly.
Yes.
You understand? Little by little by little, we are not careful about it, and then we have had it. It now become issue. Then to now lose weight become an issue. Now, therefore, we need to pay attention to our weight too. It's equally very important. These are some of the things. Some women, they have some medical conditions that they don't seek help on time. These are things that affect fertility. Seek help in the right place. You understand? Some people have surgeries done. Maybe some people, in fact, we've had some people that have fibroid surgery done by whoever and the likes, not a specialist trained to know how to prevent
Yes.
some of these things. They have, if you are able to do this, you can prevent, infertility, but it's not in all cases. Somebody has asked Does
Not
postinor
to.
affect fertility? Postinor is an emergency contraceptive, and one thing about it is that we don't encourage emergency contraceptive for couples, because one of the whole essence of marriage is for us to have a pleasurable sex. So why must you be taking postinor too? Every now and then you have sex because you don't want to get pregnant. Couples should have effective family planning method.
Yes.
And what
That
is
is good.
advocated now most of the time, because of challenges in taking maybe everyday pill, we talk about what we call long acting reversible contraceptive, what you don't need to repeat every month. It's more than a month before you take it up, whether you are talking about injectable every 2 months, injectable every 3 months, injectable, or you are talking about implant that can be inserted in the arm, you
Yes.
understand, for 3 years or for 5 years, or you are talking about intrauterine contraceptive device that can be there for 8 to 10 years, or you are talking about what we even call nephronogestrine intrauterine system, which can also be inserted in the uterus. You understand? We need to make use of that and enjoy the pleasure of sex with our partner, not posting up. Emergency contraceptive is for people that don't have sex regularly.
Yes.
Forget it, whether your husband comes during the weekend or monthly, you need to be protected if you don't want to have baby. And these unplanned babies, unplanned pregnancy, are the root causes of you know seeking for termination of pregnancy, that can get complicated and even now make it difficult for you to get pregnant when you need it. So we don't want that. So very, very important.
Someone also asked, what is fertility preservation? So,
Of course, if you are talking about fertility, if you are talking about fertility preservation, we are talking about, for women, take for example those people that
it's not
the
this
career women, they are not ready to start
family.
their family now, because of the chances of reduction in the quality and the quantity. Sometimes they can freeze their egg, they can have their egg affected, frozen for as long as possible, and when needed it can be made use of. There are some other procedures that one want to do. Sometimes we have some people that are going for chemotherapy, for radiotherapy, that can affect the quality of the eggs. They can equally preserve their fertility function. Some people have some other conditions that will demand that we remove part of their reproductive tract. We can preserve the ovaries, you understand, if it is possible. So that one is equally done. So we have quite a number of course, places where you can do fertility
Preservation.
preservation, of course, whether egg
Someone also asked that.
or oocyte, whether oocyte,
Or the
that's
sperm.
egg, or the sperm, or even embryo. We have quite a number of them in Nigeria across different cities. There are many centers in Abuja here. So it's very, very important. Yeah, somebody was asking, can does clomid, can it help infertility? Yes, I will say yes, but please, this is not paracetamol. This is not a drug that we expect you to just go over the counter and take. It should be prescribed. It should be prescribed. We don't want you to just take it anyhow, because we can abuse it and it may eventually affect the potential for getting pregnant. So it's very, very important. We need it. We want to prescribe it for you, and we'll tell you how
How
to
to
make
use
use
it.
of it.
And not
So
everyone can use clomic too, right?
it's very important. There are side effects, and there is a way we expect you to use it so that you can improve your fertility potential. Let it be prescribed. You understand? Thank you. There is someone here sending another question that how can erectile dysfunction be handled on the side of the man, and how can it be treated? Obviously, you anyone that has erectile dysfunction, we are unable to achieve erection, or we are unable to sustain erection. You need to see your doctor. The group of doctor responsible for male factor infertility are actually the urologists. You understand? But of course, we might not get to know until the couple have visited a gynecologist, and through our own history, examination, and investigation, we might know. and then we will refer as appropriate and it can be treated. So you need to see urologist. There are urologists in, in quite some hospitals around where you can visit, but just make sure you are seeing urologist, you understand, not just anybody. So it's very important.
Some people get pregnant when they meet their partner during their period. Please explain.
Ah, no,
When you
no,
get
no,
pregnant in
no.
your period.
In fact, simply put, when we talk about period, normal period, not abnormal period,
Yes,
because there are some
abnormal
people that
period.
when what we call a normal period, of course, a woman should see her period for at least 2 to 7 days normally. But during this period, a woman doesn't ovulate.
Yes.
It's a safe period. Of course, some people don't want to have sex because of the hygiene. Some people prefer it because they know, they are sure that they don't want to have,
Pregnancy.
pregnancy. So that's one thing about it. But a woman doesn't
Conceive
ovulate
during her,
during
yes, her period.
her period. What happened? Simply put, is this: you see, at the beginning of menses, the ovary recruits some eggs to grow, and out of which it looks like relay race, 100-meter race that we used to watch, all these world this
Olympic.
Olympic. Yes, we have like 8 people on the track. The same thing goes for the ovary. A number of eggs are recruited at the beginning. Once a woman starts seeing her period, at the beginning a number of them are recruited, and then they keep on growing, out of which one of them will outgrow other. Later on, will suppress the other ones. Around the mid cycle, that dominant one, when it has reached a good size, it will rupture. That is what we call ovulation. And when there is sex around that period of ovulation, that's when there is pregnancy. However, the endometrium, meaning that the inner lining of the womb, is also being prepared for potential implantation after fertilization. Now, all those things, chemical substances are being produced that will help the endometrium to be produced, so that preparing for implantation. Once there is pregnancy, we expect implantation to take place. If implantation take place, that is when a woman will not see her period again. When there is now no fertilization, then endometrium, the inner lining of the womb that has been prepared for implantation and baby's growth, there will not be hormones to sustain it, to keep it in that good state again. And because of that withdrawal of the hormone that were helping it before, it will start shedding. And that's why some people will say the endometrium that is crying. That's why you see blood. You understand? So it is not possible. There is no ovulation during menses, except people that have bleeding around the time of the spot around the time of their ovulation.
Someone said, you said something about pleasurable sex. How can a man who experiences premature ejaculation be helped to be able to have pleasurable sex that can lead to pregnancy? So, like we said, you have to see a specialist
This is
and be referred
very
appropriately. You can't
this
do it on your own. You must see a specialist to at least diagnose you and fix what the problem is exactly.
some people anxiety, some people, even the woman, the way God made us is such that men, we are easily excited about sex. Women, if they are not, especially around the time of their ovulation, which by which time there are some hormones that make them to have sexual desire, you have to do some foreplay and all those. And meanwhile, the man is already
Right.
high. you know by the time you now agree for the main thing, he don enjoy himself. He's almost getting to the point of resolution, ejaculation before. Of course, it will be time. So that's why you need the couple, not just the man. The couple need to see their gynae, and let's be open to talk about it. It's very important.
It's not
In
shame.
fact, let me add this to it. This is one of the issues that couples have, one of the things that causes disharmony in family, and it's important. Yes, it's very important. Thank you, our dear
Listeners.
mother or sister that have raised this question. women, quite a number of
woman.
them are enduring some things. The woman that have raised this question, some of them are enduring some things because men just want to have sex and walk away. But what about the woman? Consideration had to be given, but this is another topic entirely. Maybe we'll have another time that we'll talk about this. Yes, there have been talks that have been given even in religious setting because we are all social being and this is very important. Yes, we talked about it at some other time. But please see your gynae, let it be uh, discussed personally, one on one. For men, can masturbation affect their fertility? Well, the first question is why masturbating? You understand? That's the first question. What is the cause of masturbation?
Maybe when your partner is not around.
Ah ah.
Your partner
Then
is not available.
then no, we understand. I understand. There are certain things that has to be done because we are talking about fertility potential. You understand? Because these are the things that we talk about, and when couples come for fertility treatment, these are the things that we want to resolve. These are the things we want to talk about. You understand? If there is a need to bring ourselves together, it is very important. We need to look into it because these are problems that that uh, if you don't raise it, we might not know.
Absolutely.
It's very, very important. But obviously, I want to tell you that probably this can affect how long a man lasts, how whether the sex is going to be pleasurable or not. But in terms of the production of semen, we don't it doesn't have direct implication on that. The main thing is how frequently does he masturbate? Has he ejaculated? You understand? Frequently, because with the frequency, of course, if you have sex
Respect
regularly, we
reserve.
expect the drop in the quantity of what is
Yes.
being produced during sexual intercourse. But we want to discourage, we want to advise as much as possible couples that are waiting,
To
for
have a
their own
baby.
babies to have baby. They need to have regular sexual intercourse, and I'm adding to it pleasurable sex. That will not make you to be discouraged. It's very important. How do women know
When they're
that they are ovulating?
ovulating.
Yes, there are certain things that women can know. You understand? They can see personally that can help them when they are ovulating. One, around they can have a discharge.
Yes.
What we call the cervical mucus, usually clear, light, stretchy when you touch it,
Slippery.
and it's slippery. You can stretch to a distance, in fact, like 8 to 10 centimeters, a wide distance.
Yes.
You understand? Before it will break, they are around the time of their ovulation. They can have what we call mid-cycle pain. You understand? It could be on the right, it could be on the left, depending on which ovule is actually releasing the egg. So it's one of the things they can have. Of course, it may start from one side, and because of the release of fluid and little bleeding that comes with ovulation, it can later become, involve all the lower abdomen. So very, very important.
And also
Of
tender
course,
breast as well.
yes, the breast can be full and tender sometimes. For some people, they can have that. It's not 100%. You understand? So that is that. The temperature can equally drop. Okay, but you will need to check your temperature. And what is advised is that around the time of your ovulation, you understand? Before you get out of bed, you need to check your temperature. By the time ovulation has taken place, of course, there will be a little drop before rise in the temperature, about 0.5 degrees centigrade. That's one of the things that a woman can know. You can equally, of course, you can do tests. There is ovulation test kits.
Yes.
Most of our women out there knows it. Ovulation test kits that once there is release of one particular hormone, luteinizing hormone, it will become positive, and within 36 hours after its release, of course, we expect ovulation to take place. Follicular tracking, which involves scan. The scan the scan will be that scan will be done serially to continue to follow up on the growth of the dominant follicle. So that's very, very important. This is one of the things that we can equally uh, take note of.
Sarah, I wanted to point something out. Women who have ovulation pain, how are they encouraged to have sexual intercourse if they are already in pain? Would you advise to take painkillers
Yes,
before you have
of
sexual
course,
intercourse?
we talked about pleasurable sex. A woman that
Yes.
is having pain during sexual intercourse will never enjoy sex.
Mm-hmm.
So we need to look at that. But in terms of ovulation pain, it is important that we take analgesics, painkiller.
Yes.
But if a woman is having this significant, let's talk to our doctors so that we can be advised as appropriate. We are
Yes.
not asking you to go and get over the counter drugs. Please, it is very, very important.
So, someone also asked, what are the risk and success rates of fertility treatments?
It is
The
dependent on the kind
IVF
of
fertility treatment.
fertility treatment that we're actually making use of. You understand? Some people, some women, we have what we call ovulation induction agents. Each of the agents that we make use of have their own success rate. You understand? How many cycles of ovulation induction agent are we going to give? That was why we discourage our people from making use of clomid. Somebody asked that question
Yes.
about clomid. You don't just make use of clomid or some other uh, fertility drugs or injections anyhow. It has to be prescribed so that it can improve the chances of conception. So that is that. IVF too has its own rate of success rate. The same thing go for what we call intrauterine insemination. That's IUI. The success rate differs. But commonly, if you are talking about IVF, the average success rate is about 30 to 40% generally. However, some factors will also contribute to its success rate.
Like the age.
The age or the ovarian reserve, of course, the condition of the uterus, all those things very important to in determining the success rate. So it's very important. Well, if you are just joining us, we've been talking about fertility issues, common questions about fertility issue. And Dr. Taiwo, with me is Dr. Winne. We cannot exhaust all the questions about fertility. It's a world of its own. And that is why we encourage couples that are having delay in getting pregnant to see their gynecologist.
Yes.
Have a time. Usually, the first consultation is usually longer than subsequent one because we want to take history, detailed history for the male and female partner. We want to examine, and then we will definitely ask you to do appropriate investigation and give you some other counseling things that you need to do, like having adequate regular, adequate, unprotected, penetrative ejaculatory sexual intercourse. Very important, which will help. Like counseling you on the fertile period, very important. So these are the things and what we need to do. So if you have further questions, please you can send in your questions to us at any time. We will respond to your questions. If you want to see us physically, you can visit us or you can visit your doctors, whichever one. But please make sure you see a gynae when you have questions about fertility, not just seeing random person, people that have experienced it before, how they treat them. It may not be the same thing. You understand? See your doctor. And we pray that as we continue to make efforts, may God continue to bless our efforts.
And I would also want to add something. The sooner the better with fertility. Don't wait. Don't go to church and see your pastor. See a doctor. The sooner the better. The sooner you come, the better your chances are at conceiving. Good luck to everybody trying.
Thank you
for joining us.
We want you to join us next time, next week, when we'll be having another topic. It is always an exciting time when we come on Instagram Live, coming to discuss various health issues that affect our lives. We'll be happy to have you next week Friday. Thank you.
Bye.
Bye.